Welcome to the world of cerebral palsy, a condition that affects millions of people worldwide. Understanding and managing cerebral palsy can be challenging, but with some guidance, it is possible to live a fulfilling life. Cerebral palsy is a neurological disorder that affects movement and muscle coordination. The condition poses challenges to people in their daily lives. Cerebral palsy is not a rare condition. It affects about 17 million people across the globe. This condition has no cure, but it can be managed with appropriate care and treatment. There are three main types of cerebral palsy: spastic, dyskinetic, and ataxic, each with different symptoms and management options. Understanding the type of cerebral palsy you have is crucial to know how to manage the condition. Stay with us to explore everything you need to know about cerebral palsy, from causes and symptoms to adaptive technologies and potential cerebral palsy. Oh, cerebral palsy sounds like some fancy neurological disorder that only important people get. But guess what? It's not that fancy, and it can happen to anyone. In simple terms, cerebral palsy is a group of disorders that affects movement and coordination. So, what causes cerebral palsy? It can be divided into two broad categories: prenatal causes and perinatal postnatal causes. Prenatal causes include genetic mutations, infections during pregnancy, and lack of oxygen to the brain. On the other hand, perinatal postnatal causes can be things like premature birth, infections after birth, or brain injuries. Now let's talk about the symptoms. People with cerebral palsy can have a range of symptoms, from mild to severe. This can include things like difficulty with muscle coordination, stiff or weak muscles, tremors, and trouble with balance. Other symptoms can include difficulty with speaking, seizures, and even certain cognitive impairments. Okay, that's enough of the serious stuff. Overall, it's important to remember that no two people with cerebral palsy will be the same. It affects everyone differently, and that's okay. So, whether you have it or you know someone who does, remember that they're still the same person underneath it all. And hey, they might even be a little extra special. Diagnosis and treatment of cerebral palsy. Screening and diagnosis of cerebral palsy is crucial in order to provide timely management and treatment. The diagnosis is based on physical examination, medical history, and a few other tests like MRI and CT scan. While diagnosing, doctors also evaluate the severity and type of cerebral palsy to ensure appropriate treatment. It's important to keep in mind that early diagnosis and therapy for the condition can improve the patient's motor skills and overall quality of life. The goal of treatment is to help the patient achieve maximum independence and functionality. Depending on the severity, different treatment methods like medication, surgery, and therapy are recommended. Therapy is one of the most common management options that cover physical, occupational, and speech therapy. These can help improve body strength, balance, and range of motion. Therapy can be customized according to the patient's needs. It's a continuous and collaborative process that requires patience and hard work. Generally, it takes a dedicated team of therapists, doctors, and caregivers to provide the best possible care to patients with cerebral palsy. Challenges and common conditions associated with cerebral palsy. Living with cerebral palsy can be challenging on both a physical and emotional level. Individuals with cerebral palsy often face a lot of challenges in their daily lives. Mobility can be a significant challenge for people with cerebral palsy, and some individuals may require mobility aids such as wheelchairs, crutches, or walkers. Additionally, individuals with cerebral palsy may experience difficulty completing activities of daily living such as dressing, bathing, and eating independently. Furthermore, communication can also be a significant challenge for individuals with cerebral palsy, and some individuals may require communication devices or augmentative and alternative communication (AAC) strategies to communicate effectively. The level of severity of the condition may vary from one person to another. In addition to the gamut of daily challenges that people with cerebral palsy face, they may also be affected by a range of conditions associated with the condition. Some of the common conditions include epilepsy, intellectual disability, and vision or hearing impairments. These associated conditions may require separate treatment alongside managing cerebral palsy. Living with cerebral palsy requires considerable support in daily activities, such as obtaining an education, seeking employment, and access to adequate health care. However, a personalized approach to therapy and support can help individuals with cerebral palsy maximize their ability and independence. Caring for people with cerebral palsy. Taking care of people with cerebral palsy can be both a challenging and rewarding experience. Home care for people with cerebral palsy involves ensuring their safety and comfort while helping them with daily living activities. In many cases, people with cerebral palsy will need assistance with mobility, so it is important to make sure that the environment is safe and accessible for them. Care by professionals such as physiotherapists, occupational therapists, and speech therapists can be very helpful in managing the condition. These professionals can also help people with cerebral palsy develop new skills and learn how to cope with their condition. Support for people with cerebral palsy and their caregivers is essential. This may include peer support groups, counseling, and respite care. Caregivers may also benefit from training and education on how to care for people with cerebral palsy, as well as learning about available resources and services. It's important to remember that caring for people with cerebral palsy requires patience, understanding, and compassion. While it can be a challenging experience, it is also incredibly rewarding to help someone overcome the obstacles related to their condition. Adapting to life with cerebral palsy. Adapting to life with cerebral palsy. Living with cerebral palsy, CP, comes with challenges, but it definitely does not mean a life without opportunities. People with CP can maximize their abilities and live independent lives with the right support. Assistive technology has improved to the point where it can meet different needs and lifestyles. Smart speakers, voice activation, computer modifications, and other tools can significantly improve the quality of life for someone with CP. Employment can be a challenge for people with disabilities, but it is not impossible. The internet has opened up new opportunities for remote work, self-employment, and entrepreneurship. CP, despite its limitations, can become an asset to business owners, especially considering the unique perspective that people with disabilities offer. The CP community also has role models who have achieved great things despite having the condition. Be inspired by the likes of comedian Josh Blue, Paralympian Mallory Wegeman, and motivational speaker John Quinn. There are also groups and organizations dedicated to helping people with CP make the most of their lives,